This one took me a second. I had to think about this one. My favorite DrPH project. My name is Jackie Mesenbrink, and I received my, I guess, MPH and doctorate DrPH from Jiann-Ping College of Public Health. So currently now I'm working as an assistant professor in the Waters College of Health Professions in the Health and Kinesiology department under the Master's in Health Administration at Georgia Southern. I think my favorite part all around was making connections with the faculty, but also making connections with students from all over. So currently, like I still am in connection with friends that I have that lived in New York that would come to our doctorate classes. So I think having friends, but also public health colleagues really that are part of your now network just from the program, I think was big in both programs. This one took me a second. I had to think about this one. My favorite DrPH project had to be in Dr. Appentang's class. We did the communications project. The reason I find that the most interesting is because we all were living somewhere else. So I was living in Georgia. I think one other group mate was in Georgia, and then another classmate was in California. So it was just like the dynamic of getting to know them and working together. We had to do a lot of stuff via Zoom, and this is prior to the pandemic. So I think it kind of set us up to be adaptive and to collaborate through, I mean, really nationwide at that point. As a team and to make a product. And I just really like the subject of health communication. So I think that the combination of the two is probably my favorite project so far. Good question. I mentioned some of them, like collaboration, being adaptable. Some of the other things I think are just skill, like communication, some of those soft skills that we need to have in public health, being able to frame a message correctly, and that's going to happen regardless. Like, me working as a professor or someone working in directly in Department of Public Health are going to have those skills. So I think that that is what my biggest takeaway was, and what I've used moving forward is just that knowledge, and also the ability to be able to find knowledge. That was something I didn't come into both of the programs with. My doctorate, I obviously came in with a little more, but coming into the master's program, I didn't come with that. I didn't know how to, do literature reviews or how to find evidence-based practice. So that was something that I learned through my graduate assistantship, but also really through the program to be able to apply those. The best advice by far that I still carry today is you get what you give. So with the doctorate and the master's, you really get out of it what you put into it. So if you put a lot of work into doing posters and applying for scholarships for presentations, you get out of it so much. While if you don't do that work, you don't maybe get out of it the same thing. So that has been, I carry that in my master's. I was told that in my master's, and I carry that really truly in my doctorate, and I still carry that today. So I think my advice is to, I mean, prepare yourself, be ready for what you're taking on, the responsibility that you're taking on. And again, with the advice, it's you get in what you put out, or you really So taking that knowledge before you get here is really important, to be able to ask questions, and to know that a lot of the things that you're doing are learned skills. Not most people, pretty much no one that comes into the program has the skills right when they get there. So being able to ask those questions and sometimes be really out of your comfort zone to ask, is this what I'm supposed to be doing, or where do I find this information, can be extremely valuable to being successful in the program.